This Medical Minute is brought to you by Avera.
Starting on January 1st, the new insurance plans of the Affordable Care Act will go into effect. However, open enrollment gets underway in just a few short weeks.
But what do the changes in health care really mean for you? In tonight's Avera Medical Minute, Jake Iverson explains why you shouldn't feel overwhelmed about your coverage.
It's nice to be able to, love what you do for a living.
Nick Chryssopoulos is his own boss. With a leap of faith, he started Woodworks by Nick.
Yeah, I started out as a cabinet maker.
But by leaving his previous employer, he's now on his own for health insurance.
Evidently, there's going to be changes coming up effective in January, and I really have no idea what that could be. Is it going to be for the better or for the worse? I really don't know.
What Nick is worried about is the Affordable Care Act and the changes it will bring to the health insurance world.
My biggest question is is it going to affect my policy? Is the price going to go up? Am I going to get any assistance, to where it balances out and keeps my payment lower? Again, the copay issue, how is it going to affect that?
Most people are like Nick and don't fully understand the insurance lingo or can't tell you the difference between a premium and a deductible. So how do you know what's best for you? Well, starting in October, shopping for insurance will be like shopping for an airline ticket. On the insurance marketplace of healthcare.gov, you'll be able to pick and choose the plan that works best for you.
So people will be able to say, well, I want a high deductible or I want a low deductible. I want a lower monthly premium, or maybe I'm willing to take a higher monthly premium. And it'll be a lot more easy to compare.
The biggest overhaul of healthcare is guaranteeing patients receive care. So every plan in the marketplace provides essential coverage, regardless of your pre-existing condition, meaning things like emergency services, any hospitalizations, maternity and newborn care, prescription drugs, rehab services, and pediatric doctor visits will all be covered by insurance, just to name a few.
And some of the good news is that those doctor visits that you have, those copays that Nick mentioned, those copays now accumulate toward the out-of-pocket maximum, which they currently don't do in today's world.
For small business owners and people who qualify, there are also tax credits available to help reduce premiums and to ease the financial burden.
For folks who have a concern that if they lose their job, if they want to be an entrepreneur like Nick and they want to go out on their own, they can get insurance and they know that that insurance is going to cover them when they need that insurance.
Let's face it, health insurance, like filing taxes, is a confusing topic, and it doesn't hurt to shop and ask around.
I would recommend that you research as much as you can and just get as educated on the topic as much as you can.
And then I always tell people, go to your trusted broker or agent, somebody you know, and they exist in all communities within South Dakota. So there'll be lots of resources to help answer those questions.
Working with drills and saws, it's very easy to lose a finger or two. Luckily, Nick's only had a few close calls.
Nothing too catastrophic, but yeah, minor ones.
But with the coming changes, insurance is the last thing he has to worry about. With your Avera Medical Minute, I'm Jake Iverson, KSFY News.
Avera Health Plans are just one of the providers listed on the marketplace. If you have any questions about the changes to health care or what plan works best for you, you can speak with an insurance expert by calling 855-MY-AVERA. As always, you can find more information as well by calling 877-AVERA or visit ksfy.com and then click on Health.
And